sensations might you feel during the birth of your baby when you are having a cesarean birth? What tips can help you through those sensations you might feel? And if you yourself had a cesarean birth, let me know in the comments below what sensations you felt and what helped you feel comfortable and calm and have a positive birth experience. So most cesarean births are done under an epidural or spinal anaesthetic, so you will feel the sensations of the injection in your back and either the spinal or epidural before you have your cesarean birth. Sometimes you may have a general anaesthetic. This tends to be more in emergency scenarios, alternatively where an epidural or spinal is not possible. Then when you are nice and comfortable, the epidural or spinal is working well or the general anaesthetic's in place, what will happen then is you'll be asked for your consent to place a catheter into the urethra at the top here, where it will empty your bladder. What this does is it means that your bladder is nice and empty. There's no big balloon of a bladder as they start making the incisions and cutting through the layers. This reduces the chance of bladder damage and bladder injury to you. You may feel the touch sensations of your legs being moved and the urinary catheter going in, but you shouldn't feel any pain or discomfort because the anaesthetic's on board already. Some areas will do a cleanse internally inside the vagina at this stage, and you may feel that. You should be asked for your consent prior to this. The whole reason the pre-swabbing is done these days is to reduce the chance of infection, to keep the area as clean and as sterile as possible, to reduce the chance of a wound infection later down the line. If you know you're having a cesarean birth during pregnancy, this should be discussed with you antenatally during your pregnancy, and again at the time that this is happening. You may again feel the movement of your legs when this is happening. It tends to happen straight after the urinary catheter is inserted, but you shouldn't feel any pain or discomfort with this. The drapes go up, the cleaning of the abdomen happens, and they start to make the incisions, which you should not feel. A good working epidural or spinal, you shouldn't feel any of the incision sites. But what will happen is as they get through to the baby through the uterus, what you may feel is some pressure and some pulling and some tugging at that stage as that baby's head is coming through the abdomen at this stage, but also because the second operator, the second surgeon, will also be placing pressure up here as well. It can feel like someone is doing the washing up in your tummy, is the easiest way to describe it from experience. It can feel like a lot of pressure, but only for a couple of minutes maximum. Sometimes as little as sort of 10 to 15 seconds to get baby out. And just as that baby comes out, what will happen then is once the baby's out, you will feel less pressure, less discomfort, and you will suddenly feel like everything is a lot more comfortable at that stage. This is where the delayed core clamping of your placenta can happen too. And then at some point, the obstetrician will put their hands inside and also remove the placenta at that stage. You may feel again just a little bit like the washing up is happening within your tummy, just some pressure and really weird feelings, but it only takes about 5 to 10 seconds to remove that placenta. So what helps with these sensations? Well, firstly, good communication from your care provider, letting you know that you're about to experience that pressure, that pulling, and the washing up sensation in your tummy so that you're prepared for it. Second thing is up breathing. So what I want you to do is take a deep breath in. Breathe in until your lungs feel like they're full, and breathe out through your mouth, jaw nice and loose. And what you're going to do is through those breathing techniques, and this is where your birthing partners can come in who are holding your hand in cesarean birth, is they can really guide and coach you through, and getting them to tell you some amazing things that you are looking forward to. It's what I call affirmations, personal affirmations. So you're looking forward to your first cuddle, the first time you have skin to skin, the first time you see how much hair they have, because you're about to meet your baby. This is the amazing thing. All that pressure sensation, very, very limited time, but you're about to meet your baby. And doing those breathing techniques, having them say the affirmations that you are really excited about meeting your baby, whether that's the first glass of Prosecco in the postnatal period, your tea and toast in the recovery area, whatever that looks like, get them to tell you these wonderful and amazing things. Have this on your phone ready to go. And music as well. Music helps to reduce anxiety, it helps to reduce the amounts of pain relief a woman needs afterwards, and it also increases the chance of a positive cesarean birth. Hopefully that's helpful, and if you want more pregnancy, birth and parenting information, hit the follow button for more.